It is now the law for the NHS and adult social care services to comply with the Accessible Information Standard. The Accessible Information Standard was introduced by the government in 2016 to make sure that people with a disability or sensory loss are given information in a way they can understand. The standard specifies what professionals need to do to comply with the standard. Professionals need to ask, find out if the person has any communication or information needs, and if so, what they are. Record, record those needs in a clear way. This can be done on a computer or on paper. Highlight, make sure that person's needs stand out in their records. Share, include information about a person's communication needs when sharing other information about them. Lastly, act, make sure people get information they can use and understand. Healthwatch Lewisham asked local residents with sensory and learning disabilities if the standard improved access or were there still gaps. We spoke to Lewisham residents with sensory and/or learning disabilities. We asked them to share their experience of access and communication with local NHS and social services. We wanted to raise awareness by informing local providers of the new requirements under the Accessible Information Standard. To reach out to people with sensory and learning disabilities, we worked in partnership with 8 organizations and community groups including Salvis, Headway, Wheels for Wellbeing, Feeling the Noise, Socialize, Lewisham Deaf Community Association, Action for Hearing Loss, and Lewisham Speaking Up. We identified a number of issues that this group still face when accessing health and social care services. Many people with additional communication needs may not have the confidence to request support. Many disabled people are still contacted in inaccessible ways, such as small print to those with visual impairment or calls to people with hearing loss. People need to often repeat the same information to providers and need to re-explain their communication needs. Getting from the reception area to an appointment room is often a great barrier. Many feel lost and confused, not knowing which direction to go or who to follow, even if they hear their name being called. Some people are unable to read the hospital menu or do not know whether their food or drink had arrived. They may also not be aware of when their medicines are being delivered to them. There are a few things that services could do to improve access for people with learning and sensory disabilities. Use of alternative communication methods that suit the individual, such as large print, 18-point size font, text messages, email, easy read, and sign language interpreters. Introduce a flagging system for NHS and social care staff about a disabled patient's preferred communication method. Sign language. Interpreters booked routinely for patients that require them with written confirmation for reassurance. If for any reason an appointment has been cancelled or rescheduled, it would be useful to ensure the next one is booked as a matter of urgency. Provide large print, minimum 18-point size font on medicines to help people with sight loss and/or with learning disabilities read information on their medicines more easily and safely manage their health. Ensure that people with sensory and learning disabilities are treated with extra care during meal times and when their medicines are dispensed. Menu choices should be explained and assistance given when food and medicines arrive in the appropriate way. Support of unpaid carers and care workers is greatly appreciated by people with learning difficulties and facilitates easier access. Offering assistance to physically guide them to the consultation rooms from the reception would improve patients' experience.